Cataract is one of the commonest problems that we see. It's one of the most successful eye surgeries that is done in the modern world, something that has, more than 98, 99% of success rate, which is more than any other surgery, any other branch that you could see. So cataract is essentially, there are multiple layers of the eye. If you can imagine from the front to the back, the front of the eye, we discussed about this, was the cornea, the clear front bit of the eye. Then you have the lens, which is the natural crystalline biconvex lens inside the eye. And then you have the retina, which is the back of the eye. Cataract comes from the word waterfall, actually. I don't know why, but cataract essentially is the milky clouding of that natural crystalline lens. Okay. So the natural crystalline lens becomes cloudy, and it reduces the amount of light that is coming inside the eye. And that is how the patient's vision decreases because of cataract. And the lens is inside a bag, which is called the capsular bag. Cataract is essentially just the clouding of that lens, the clouding of the natural lens, which reduces the light that comes into the eye because it's got a physical obstruction now, and therefore reduces the patient's vision. Cataracts normally develop in patients who are more than 50 or 60 years old, and we call them senile cataracts or age-related cataracts, which is the age-related degeneration that we talked about. That is the major chunk of cataracts that we see. Say 80% cataracts are those. But the remaining 20% cataracts can happen literally in all age groups. Right from babies who can be born with something called congenital cataracts. They have cataracts at birth, which need to be taken out. You can have younger children who have trauma to the eye or other diseases, some infections, which then cause cataracts. These are younger patients. You then can have middle-aged patients who have inflammation in the eye, uveitis in the eye, which causes something called secondary cataract. You can have patients with diabetes and other metabolic diseases, which then cause cataracts, which then occur in a younger age group, like in their 30s and 40s, which therefore need cataract removal. But most of them, 80%, will be in the elderly age group. Cataract is essentially a degeneration of the protein. The lens, or the natural crystalline lens, is made up of protein. Imagine it's an egg. Okay. And when you heat an egg, or when you heat an egg white, what happens is that the translucent, transparent egg white becomes opaque. It gets opacified, or it becomes white in color. Now, it's pretty much the same thing, except for it is not heat. But any protein, if it gets affected by age or degeneration or by metabolic conditions, then it undergoes degeneration. And degeneration means it loses its transparency. And a transparent lens is an absolute prerequisite for having your 6/6 and 6 vision, like 20/20 vision, what we say. If you want to read 100% on the eye chart for distance and near, that lens has to be crystal clear. Okay. Any degeneration and your vision will start decreasing. And so that is exactly what happens in cataracts. That slowly but surely, as one ages, especially in a tropical country with a lot of exposure to UV radiation, if there are patients who have a lot of outdoor activities, then that degeneration is faster. Indoor sedentary lifestyles have a slower progression of that same degeneration. So you would typically see farmers and patients who spend a lot of their time outdoors who get cataracts at an earlier age than patients who have an office job, or city dwellers who sort of have pretty much an indoor lifestyle. And so UV rays do play a part as well. But it is that degeneration of the protein which causes loss of transparency and therefore causes cataract. Symptoms are essentially a decreased vision, which is the commonest symptom. The other thing that patients typically say is that night driving becomes a problem. Walking at night becomes a problem. They lose confidence ambulating at night. And why is that? Because cataract typically reduces the light which is needed by the retina. It worsens at night when the light is anyways reduced. And the other thing that patients tell us is that, when you have these street lights and street lamps, and you don't see the border of that anymore because the border is all hazy and it has gone, it's split. So the definition or the clarity of lights of things that reduces slowly and progressively in cataract. Every parent should know this, and this is why we insist that all children must also get an eye examination at the age of 1 year, 2 year, and then after that throughout school as well. Because children do get all the eye problems or can get a lot of the eye problems that adults get, but they are not able to vocalize them. So a lot of eye problems in children just go unnoticed. Children do get cataracts. Like I said, there is an entity called congenital cataracts, where there are certain infections called torch infections. So toxoplasma, CMV, herpes. There are a bunch of viruses which can affect the child when they are inside the mother's womb. And so when the child is born, they can actually be born with cataracts. So we look for cataracts. We do an eye examination for these newborn children. And there is a reflex, there's a normal red reflex which is seen when your eyes are normal. And in such children, you actually get a white reflex, which is called leukocoria, which then suggests that there is some pathology in the eye. And these children must be then referred to a higher center and their cataracts must be removed as soon as possible. Because if their cataracts are not removed in time, their visual systems do not develop at all, and they are left with blindness. While if you do treat them early, take those cataracts out, they have an excellent prognosis. They have an absolutely fantastic prognosis where they can actually live and work like a normal adult. So it is of paramount importance to just ensure that all newborn children also have an eye examination. All kids at age 1, age 2 have eye examinations, because missing a congenital cataract in today's day and age is absolutely not acceptable. As far as the eyes go, the rule here is at least once a year, get your eyes checked by a specialist. Because a lot of these things get picked up on a very routine, regular examination. So I would recommend after the age of 40 or 45 or whatever it is, just once a year, just like you visit your dentist, go see your eye specialist. A lot of the problems that we discussed in today's webinar, all of those get looked at a routine eye examination for a patient whenever you go see an eye specialist. So that would be a recommendation, that once a year is a really good timeline to get it checked. If you have other pre-existing diseases like, say, diabetes, like blood pressure, like there is some other underlying systemic disease, then I would say you should go sooner. Because a lot of patients don't realize this, but a lot of other systemic diseases also affect the eyes. Eyes are a part of your body at the end of the day, not something that is separate. So that is going to affect your eyes if you have uncontrolled diabetes, if you have uncontrolled hypertension. So looking at getting your eyes checked simultaneously becomes a very good idea. Treatment of cataract, like you said, is surgery, because the only way to remove that hazy, cloudy lens is by surgery. A patient needs cataract surgery when the cataract starts affecting their lifestyle. It means that when they can't do certain things, like we discussed, they can't drive, they can't go out for a walk, they are struggling to read their morning paper, they're struggling to watch TV. If any of those symptoms start showing up, if patients say that, it is affecting my lifestyle, then we just tell patients, yes, let's go ahead with surgery. Cataract surgery now is typically done with a procedure called phacoemulsification, which is very different from how cataract surgery was done 25, 30, 40 years ago. And now there is a very small incision, about 2.2 millimeters long, and small side ports, so literally 1 or 2 side ports and a small incision. These are all self-healing incisions. There are no sutures in the eye. There is nothing in the eye. The whole procedure, a good cataract surgery, which is routine, takes not more than 10 to 15 minutes per eye. And so recovery is much faster. We typically do this cataract surgery now with drops in the eye and to numb the eye. and patient wears only glasses after the surgery, and then they're prescribed 2 drops. So patient recovery is very fast, and the only rules I think post-op are that because these are self-sealing incisions, there are no sutures. The most common thing is to not cough, to not rub the eye, to not touch the eye, to not lift heavy weights, or to strain in any way or form, at least till the wound heals, which is for 10 days. But patients can typically get back to work or get back on with their lives in 2 to 3 days max. I would say the metabolic cataracts cannot be, I wouldn't say cataracts can be prevented, but yes, the progression of cataracts can be slowed down. Infectious cataracts, or the cataracts which are caused by infections, especially the congenital ones, I think with awareness in mothers and better antenatal care, those cataracts probably can be eliminated. Age-related cataracts, unfortunately, because it's an age-related phenomenon, it cannot be really, there's no prevention for it, but yes, you can slow the progression of that. So ensuring that your diabetes is under control, ensuring that, you are not exposed to a lot of UV rays directly, or ensuring that there's no history of trauma to the eye. These are some of the ways in which you can sort of slow down the progression of natural cataracts, which is the age-related cataracts. But it's like getting gray hair, it's a natural, normal degeneration of the body. So you can't really stop it. It's just that you can maybe delay it with a bit of a healthier lifestyle. But if it starts affecting your quality of life, if it starts affecting your vision, if you're not able to do the things you were doing before, I think it's a very safe and reliable procedure in today's day and age to just get rid of the cataracts to get new lenses in.